Today, we're going to talk about a indirect treatment for a rather severe problem. So we're going to be talking about an older guy. He's got any type of cancer that can metastasize to the spine. Um, doesn't really necessarily matter which one. So we'll say that they have blastic lesions to the lower spine, and all of a sudden they are not urinating the way that they should be. They're having upper motor neuron signs. Their feet are pointing up. We got the reflexes. And just for funsies, you throw in and out cath in there, and it drops. You drop a liter. We'll say you get a whole liter. That's the most full bladder in the world, but it serves a purpose, right? So they're just dumping a ton of urine. In this particular patient, what you're thinking about is some sort of spinal cord compression situation. Now, what you have to do, or have to think about doing, if at all possible, there's really not really any other way around it, is getting this person into surgery. But sort of similar to some other CNS issues that we've had in the past, a drug that you've got to use for these people is glucocorticoids. And the reasoning behind that for these patients is that the blood vessels are getting really dilated around this area. And when they're getting really dilated, they're becoming more permeable, and they're kind of dumping some blood into that area, and it's just worsening the issue. So glucocorticoids can kind of dampen that effect a little bit. So keep it in mind when you have CNS issues that maybe they're talking about glucocorticoids as one of the things they want to do. Okay, another topic to talk about is Hodgkin lymphoma. We're going to talk about how it happens in younger people and in older people, and it comes with higher LDH. One of those weird stories that maybe you're going to just get lucky to get is somebody who's itching all the time, just scratching themselves like crazy. Again, we'll say that they're over 60 as opposed to that first part of the bimodal. So they're not 15 to 35. We'll say they're 67 and they're itching all the time. And even just one beer somehow makes it much worse. You do some imaging study, CT would be ideal. Well, you do this image study and you find an anterior mediastinal mass in your 67-year-old dude who gets itchy all the time. This is Hodgkin lymphoma. Okay. Let's do one more. Okay. Let's do patient comes in and they have some sort of thing that keeps them at high risk for getting tuberculosis. We do these all the time. We do the what's 5 millimeters, what's 10 millimeters, what's 15 millimeters when we do the TB test in terms of what makes you a risk or not at risk. And for healthcare workers with no other, healthcare worker that doesn't have HIV would be more like your 5 millimeter, right? And your 10 millimeter would be somebody who works in a prison or works in healthcare. Now, let's say that person with healthcare comes in and you do a chest x-ray on them and you find a cavitary lesion. Doesn't even matter if it's, upper, we're thinking reactivation, lower, we're thinking primary. Doesn't matter. You say you find a cavitary lesion in somebody with risk factor for tuberculosis. And you're presented with the option of doing a workup for cancer or doing a workup isolating this person entirely just on the off chance that they have TB. And as it turns out, if you have this background with a cavitary lesion and potential exposure, you are supposed to just go ahead and isolate them. You need respirators, and I don't know if all hospitals even necessarily have it, but you need a room to isolate them in that has negative pressure. So those are the 3 things I'll talk about for this video. Thanks for watching.